To the Board of County Commissioners board briefing. Today's meeting is a hybrid meeting. Some presenters will appear in person and some will appear virtually. For anyone who is presenting virtually, which we may not actually have anyone presenting virtually today, please mute your mic when not speaking, and when presenting, make sure to unmute your mic and turn on your camera. And for all presenters, don't forget to state your name for the record before speaking. Today's board briefing is a budget note on health and safety system metrics. It's a very important one for this board. We know that we have a humanitarian crisis on our street right now, and that really demands us to act and communicate with more transparency, accountability, and urgency. In our budget funding, the Joint Office Homeless Services work in our 2022-2023 budget session that happened, or budget work that happened, this board made a note to do two of the following things. One, follow the quality improvement around data and programs analysis and the outcome metrics, helping us to understand how our services impact quality of life measures. We know that we will not succeed in moving people off the streets and into housing without data-driven decision-making that helps us track our progress and hold ourselves accountable. We know that transparency begins with good data, and I have heard loud and clear that transparency is one of the primary keys to our collective success, and I agree. How well we track the progress and success of our commitment to helping unhoused neighbors find shelter and housing must be a cornerstone of our progress now and into the future. Making decisions using data requires that we're tracking as close to real time as possible. This is going to make us more nimble, more responsive, and increase our impacts today and over time. That is why I'm announcing the formation of a systems data transparency task force, which is going to develop new key performance indicators we can track, monitor, and be accountable to. These new performance indicators are going to help us improve our systems. They will also be used to improve our contracting process and help us measure the outcomes of the work of our critical partners. And in April of this year, we'll launch an updated website for the Joint Office that will share visible and clear outcomes through a data dashboard designed to increase the transparency of our reporting. I'm confident that honing our metrics and accountability across all touch points of our complex systems of care will result in better data, improved accountability, enhanced public trust, and most importantly, getting more people into housing. This effect will keep us close to the people we serve, increasing feedback and buy-in from people with lived experience and the providers on the front lines every day. These measures are in service to maximize impact, our resources efficiently, and staying in close and continual dialogue with those most impacted. This is fundamental to our approach at Multnomah County, and one we will continue to center in our work to address this crisis. We know that homelessness is both an acute and a long-term problem, requiring thoughtful and effective solutions. We must act with urgency today, as well as with strategy and foresight to build a successful system to serve us into the future. I'm very grateful to our staff at the Joint Office of Homeless Services for your commitment to increasing knowledge and transparency, and for your service to some of the most vulnerable members of our Multnomah County community. I thank you for being here today. I look forward to your presentation. But for now, I want to turn it over to Commissioner Myron, who is joining me in this work and who authored this budget note, to say a few words. Commissioner Myron.
Thank you so much, Chair. I am thrilled that we are getting this presentation today. This is something that I too have been calling for, it feels like for years now, and having that accountability and transparency is including a baseline of where we're at so we can assess how our programs are doing, adjust if necessary, and get to a desired outcome. It is essential, and sharing that with the community in a way that's understandable and digestible is essential. And so this is why I had sponsored the budget note in our budget last year, and I am so grateful to the chair for having this as one of our first board briefings, and and for jumpstarting the process with a task force to look at these issues, and for the update to the website, which will be really gratifying to see, and I think that the public will be really grateful for. So, thank you so much, Chair, for this.
Thank you. And now we'll have hear from the Joint Office. Now we'll hear from the Joint Office. My mic wasn't on. Good morning.
Good morning, Chair and Commission. For the record, my name is Joshua Bates, and I'm the Interim Director at the Joint Office of Homeless Services. Before we dive into the presentation, I want to give each of the other panelists an opportunity to introduce themselves.
Good morning, Chair and Commissioners. My name is Anna Pendas, and I use she and her pronouns. I'm a Program Manager with the Joint Office.
Good morning, Chair and Commissioners. I'm Lori Kelly, and I'm the Planning and Evaluation Manager.
Good morning, Chair and Commissioners. My name is Kanoy Eggleston. My pronouns are she and hers, and I'm the Interim Deputy Director here at the Joint Office.
Okay, thank you all for introducing yourselves. All right, can we go to the next slide, please? So, the fiscal year 2023 budget, county budget included a budget note from Commissioner Myron asking the Joint Office to report back on two and distinct primary elements: specific outcome metrics that help us understand how our services impact health, safety, and other quality of life measures for people experiencing homelessness, as well as updates on the Joint Office's ongoing quality improvement work around data and program analysis, including but not limited to Built for Zero. The purpose of our briefing today is to provide a response to this budget note, provide an overview of the Joint Office of Homeless Services data and programmatic work, and then finally chart a path forward. Can we go to the next slide, please? So this is an overview of many of the innovations that we are embarking on to improve our data tracking and analysis. The purpose of all of this is not analysis just for analysis' sake, but analysis that will help us further our understanding of the impact of our work and make strategic decisions. We have a new data quality plan that is required by the Continuum of Care that will be completed in March, that will also help us enhance our capacity. We are launching a regional HMIS system with Clackamas and Washington County that will be managed by Multnomah County. We are developing qualitative and quantitative evaluations that seek to enhance our understanding of the impact of our interventions. And then finally, as the chair uplifted at the beginning of this, we're going to be creating a systems data accountability task force. So we're going to be diving into all of this more in this presentation, but this is really an overview of some of the key areas that we're embarking on. Can we go to the next slide, please? So another part of our update is the current state of the Joint Office's implementation of Built for Zero. We are in the midst of launching an infrastructure to utilize our data more effectively. This is launched in winter. There will also be an outreach data collection expansion that will begin this summer. And in order to move in with and sorry, I don't know what's going on with my speaking today. Tomorrow, me and my partner are expecting, so I don't know if I'm a little bit nervous about that. Honestly, something is going on. I'm like, what is happening right now? So, in order to continue the expansion of Built for Zero data collection, we are in the process of embarking on a robust engagement with folks with lived experience of homelessness and from our providers and also communities of color. All of this builds on the ongoing implementation of Built for Zero work that began in 2021. So can we go to the next slide, please? So really as a framing for this presentation and for this response, all Joint Office of Homeless Services programs affect health and safety. To us, housing is health. But with the recent and expanded programming through supportive housing services, this allows the Joint Office to focus on those areas more directly. We have funded a number of key programs that expanded capacity and address needs holistically through responding to the multiple factors that impact a person's outcomes in achieving stable housing, which is really really the remedy to homelessness. We have deeper and expanded partnerships with providers that are crucial to moving this work forward. And additionally, there are specific projects that concentrate on data from multiple sources that inform the design of our supportive housing services programming. So this is an overview of what we'll be talking about throughout this presentation. My colleagues that are with me today will give a deeper dive into these key areas. So with that, I will pass it over to you, Lori.
Next slide. So I think when moving into this, it's important to understand that there is already a variety of evidence demonstrating the connection of homelessness, health, and safety. We can see that homeless affects chronic conditions and vice versa. And one thing that we like to call out right from the beginning is it's important not to conflate correlation with causation, meaning that homelessness is a contributor to health and safety issues, but that health and safety issues also can help contribute to homelessness. So when looking at things, it's important to never deduce one from looking at the other. When we're looking at this, we can see that mental health conditions affect 24% of homeless adults versus 4% of the general population, and that substance use disorders are disproportionately represented at 58% versus 16%. Chronic conditions such as HIV and hepatitis are disproportionately represented, and as you can see, there's a clear connection between physical conditions such as diabetes and hypertension. Homelessness contributes to premature aging on an average of 12 years earlier. The average age of a person experiencing homelessness is 43. I often tell an anecdote that when I used to work in a health center for homelessness, there are certain aging tests that we didn't even do very frequently because people didn't age to the point where they would even get something like a colonoscopy. Just think about that, it's horrifying. Physical violence is also a cause and consequence of homelessness, with 30% of cisgender women and 27% of cis men, as well as 33% of transgender women experiencing physical assault. And then finally, physical disabilities can make it even more difficult to find housing. Most affordable housing is not ADA accessible, and proximity is a critical consideration to when you're thinking about whether you need to be near services or even something as similar as a shopping mall. Next slide. It's important also to notice that all of these national statistics are echoed in Multnomah County. With our most recent PIT through self-identification, we found that the majority of people experiencing homelessness have disabling conditions. 65% have at least one disabling condition, 36 have mental health conditions, 35 substance use disorder, and 23 have a physical disability. And even more notable, many have complex health needs, with one or more disabling conditions really calling out the need to approach their vulnerabilities in a variety of different complex ways in order to address the fact that 11% have trimorbidity, mental health, substance use, and either a physical disability or a chronic health condition. Next slide. And then finally, racism exacerbates these conditions. Psychosocial stressors worsen mental health and physical health. Microaggressions and trauma have negative impact. Chronic stress leads to chronic physical health conditions, echoing that causation and correlation issue. Racism can affect the general quality of healthcare received as well. And then finally, structural racism affects homelessness and health through multiple pathways. Inequities in wealth and income, housing, environmental exposures, and neighborhood quality affect healthy choices and behaviors and safety. But then also, BIPOC individuals are overrepresented in homelessness relative to the county overall. In particular, Black people are represented at 17% versus 7%, and American, Alaska, and Native and Indigenous people are represented as 13% of the homeless population versus 3% of the overall population. So we can see here that the intersection of racism, homelessness, and poor health creates complex challenges for BIPOC individuals experiencing homelessness. Next slide. So just as critical in this piece is that while housing and health are linked, housing interventions are also key in that, in ensuring that people. Am I handing this to you? I'm sorry, and I'll have Kanoy speak to that in more detail. Sorry, apologies.
I can support in this slide. Good morning, all. Kanoy Eggleston. So throughout this briefing, so for this specific slide, I think it's important to note that throughout this briefing, we're going to be highlighting how housing is health, and those are interlinked, right? So therefore, focusing on stably housing people, we are affecting health status and outcomes. So some specific interventions that influence health outcomes are the following here. We first want to talk about housing first, which most research evidence shows that a housing first approach is effective, more effective than services first approach. So housing first is an evidence-based strategy recognizing that housing and the safety and stability it provides is a necessary step to helping people rebuild their lives. So housing first is not just housing only, but it's housing first, and that starts with a solid foundation. So it's a safe place for folks to live, and it builds then upon healthcare, treatment, social services, education, and work support connection. Another specific intervention we want to speak about that influences our health outcomes is permanent supportive housing, right? And so you all are well aware of this intervention and how it combines our ongoing rental assistance and with supportive services to address the needs of our chronically homeless folks. This service is designed to build upon living skills and connect people with community-based healthcare, treatment, and other services. This permanent housing paired with supportive services improves health and safety outcomes. As an example, much of the decline in veterans' homelessness between 2009 and 2019 is associated with the increases in PSH for veterans. And then lastly, another intervention is the Affirmatively Furthering Fair Housing Rule, which directs HUD and associated funded programs to combat housing discrimination, eliminate racial bias, and take meaningful actions to address barriers that restrict access to opportunities based on protected class. So the example here is with HUD that provides technical assistance to local jurisdictions in assessing their needs for housing accessibility to persons with physical disabilities. I'm going to transition us now to Anna, who's going to be speaking on the next slide as she covers some joint office funded programs that speak specifically to our health and safety. Next slide, please.
I think this is Lori.
This is Lori.
Oh, I apologize.
We don't have our handoffs planned. Okay, so it's important to notice that with tracking outcomes, the Joint Office designs and funds systemic interventions that address health and safety by connecting people to housing and critical homeless services. Housing and homeless services have a demonstrated direct and indirect impact on health and safety, and what we measure is access to these services and their ability to get and keep people housed. So here you can see a couple of the key data points that we measure in order to keep our eye on that. So we have in the last year, so this particular data point is 18 months. And the reason this is 18 months is because it tracks from the beginning of the Supported Housing Services Measure funding. So in that time, we have seen 10,260 people enrolled in housing programs. And we have seen 50,920 people who avoided homelessness with prevention services. Next slide. We've seen 8,730 unduplicated people served in shelters, and we've seen 5,450 people placed into housing with our programs. Next slide. So on top of those measures, we also track other things quarterly. We track housing retention. Now, currently, if you go to our website, you'll see that this is under construction for a really good reason. There are a variety of measures that people use to figure out whether people are staying in housing, but none of them are really telling the whole picture. So right now, we're doing our own little mini task force, working with other COCs in the area to figure out what really is the best measure or cluster of measures to figure out not just are we housing people, but are people staying housed after they go into housing. So within the next 3 months, I would look towards those cluster of measures being back up on our website to show whether people are not just returning from homelessness or staying housed by tracking, but also whether what we can learn by looking at multiple measures at once. In addition, we track program level outcomes and outputs on a quarterly basis. We have a shelter utilization report, and we track demographics within each and every program to ensure we're centering equity. And you'll see a little link there at the bottom. If you were to click on that, it would take you to our Tableau site where you can dive into all the metrics that I just described and actually disaggregate not just by demographics, but also by age and by program. Next slide. And now I will hand this over to Anna.
Thank you, Lori. Anna Pendas, and I'm going to go through these next few slides to highlight some of the programs that are more specific to health and safety. First, I want to talk about our navigation, outreach, and engagement supports. The navigation team, which is led by TPI in coordination with Central City Concern and Mental Health and Addiction Association of Oregon, supports high-impact encampments through a collaborative process. The focus on coordination and person-centered outreach brings critical survival support to people who are unsheltered by providing basic health and survival services and assistance with service navigation, including navigation to shelter and other services. Outreach workers on that team include individuals with lived experience of homelessness, people with specialized training in behavioral health, and people with medical training, people who specialize in working with women, veterans, and other unsheltered people in specific geographic regions of the city. Metrics for this program include the number of people per year who are outreached, number of people moved to transitional and permanent housing, and the number of people who are referred to treatment programs. Next slide, please. Our street-based medical care program, we have Portland Street Medicine, who is providing street-level acute and chronic medical care to people who are experiencing unsheltered homelessness. Some of the metrics included in this programming includes the number of medical outreach encounters and the number of patients who are served with case management. Next slide, please. In our encampment waste removal projects, we have an expansion of the Clean Start program through Central City Concern. We also have the Workforce Cleaning Brigade led by Cultivate Initiatives. Some of the metrics that we're looking at through these programs include the number of people who are receiving employment services and or working on workforce crews. Next slide, please. Cultivate Initiatives leads a mobile shower and hygiene response program, providing mobile hygiene services where people need them, including 2 partner sites like the We Shine Village. Metrics for that program include the number of shower and hygiene sites that are operated, number of showers and hygiene services that are provided, and the percentage of people who are accessing preventative care, preventative medical care through this program. Next slide, please. Our severe weather response, which it's worth noting that we just ended a severe weather episode. In the event of severe weather, we have, which significantly elevates the risk for people sleeping unsheltered in the community, additional shelter capacity is created and remains in place for the duration of a severe weather event. The JOHS invests in base funding and severe weather shelter sites operated by contracted nonprofit service agencies and distributed across the county. The JOHS also budgets for costs associated with opening additional severe weather capacity in partnership with county and city emergency management in those situations where nonprofit provided capacity is not sufficient. During severe weather, that commitment is that no one is turned away from shelter. During severe weather episodes, we also have expanded street outreach. This program offers additional funding to street outreach providers to assist in reaching adults, youth, veterans, and families in accessing safety off-the-street resources during severe weather. Prior to a severe weather activation, JOHS will work with contracted providers, community-based organizations, and mutual aid groups to provide necessary gear through our supply center. JOHS works with these groups to do coordinated outreach missions to ensure that supplies and information reach unsheltered neighbors throughout the county. Coordinated outreach efforts from city and county to people who live and work in places that put them at an increased risk. And next slide, please. So our SHS funds long-term rental assistance and housing placement services to 125 people, including the following service components. We have 125 long-term housing vouchers with our ACT client assistance pool. There is FTE included for housing search, navigation, and placement. Eligible individuals are served by any of Multnomah County's assertive community treatment and intensive case management teams. Those teams provide an intensive level of community-based ongoing support services to people with severe and persistent mental illness. And then SCOPE provides a tool for multiple departments within the county to approach clients in a more informed and holistic manner. Next slide, please. So our recently funded SHS-funded Domestic and Sexual Violence System Navigator and Housing Assessor project. Although all county-funded DV and sexual assault system services could be considered in support of a survivor's health and safety, this is 2 programs that we really want to call attention to that are new investments made possible by Metro SHS. The first is the development of 2 FTE system navigators and assessors. One is stationed at the Gateway Center, which is a community hub for domestic and sexual violence services, and the other is a community partnership with Volunteers of America. This new resource brings dedicated case management resources to connect survivors to who are seeking domestic and sexual violence resources to short and longer term housing resources available across the continuum. These case managers are conducting safety and stability assessments to match survivors to available resources and provide connection to system services. In many cases, that's providing capacity to develop individualized safety plans when needed. The other program that we would like to talk about is currently in development, moving through its final funding award allocation process after conducting an SHS NOFA just a couple of months ago. This new program is with domestic and sexual violence shelter in-reach team. This team will provide shelter-based case management and advocacy services at shelter programs across the adult, family, and youth shelter systems. We know that survivors don't, seek shelter throughout the entirety of our system, not only in domestic and sexual violence specific programming. And for varied reasons, survivors may not be best served or want to be served by the DV shelter system. So there's a need for the system to be able to reach them where they are in other points of our continuum and shelter services. Additionally, the DV InReach team is also able to provide technical assistance to shelter providers across the continuum while working with survivors to improve those experiences and outcomes to survivors in their program. And with that, I'm going to pass it back to Lori.
Okay, next slide. So switching back to some of our more data-driven programs, we have some programs that utilize data for multiple programs as well as cross-departmental partnerships. One example of that is FUSE. FUSE, or Frequent User Systems Engagements, is a proven model developed by the Corporation for Supportive Housing, identifying frequent users of jails, hospitals, and homeless services, and then improving their lives through supportive housing. So in 2021, we did a study with notable findings on the value of such services in key intersections, and this year we're moving forward with that and adding services to that. So in 2023, we're designing an enhanced model of permanent supportive housing with services designed to meet the needs of FUSE participants. We'll be identifying 50 frequent users with PSH and also designing a system of referral pattern to make sure that people are getting into that housing. And then this is a partnership between DCJ, DCBCH, the Department of Behavioral Health, and HealthShare to integrate analytics and also consider housing from a holistic approach. And you can see that the metrics associated with that are the creation of the list, the number of individuals targeted, and then always the numbers of individuals retaining housing. Next slide. So I'm going to be switching gears a little bit and talking about our data plan. As we enter into the new year, the Joint Office has charted a course in 2023 with 3 general improvements that will bring us into a more evolved place when it comes to data standards. So first of all is data quality. The Joint Office has used the current A Home for Everyone data quality plan, but it's in the process of working collaboratively with community partners to amend and create a more robust plan. This plan is based on nationwide practices, and upon its implementation, will apply principles of continuous quality improvement. We'll be monitoring the quality of data over time and implementing agency-level TA towards getting better data level at the ground level, where the data comes in. The second is regionalization of HMIS. Sorry, we're on, good. With the goal of creating a tri-county regional system, the SHS measure was the first in many steps, but now we're moving into the first and second quarter of the calendar year, and we're moving towards a localization of HMIS that will allow each county not only greater control over their data, but the opportunity to collaborate around data governance and come towards regional metrics. This collaboration will enhance our mission and evolve the system to a regional perspective. And lastly, I want to talk a little bit about infrastructure and modernization, utilizing principles of public health modernization to suggest infrastructure enhancements to current systems like HMIS, which in their current state, frankly, have limited reporting capabilities that result in long lag times from reporting and manual processes that compromise the ability to deliver timely and accurate data. We're creating infrastructures on the back end like a data mart that will allow for increased capacity for programmatic monitoring and quality QA and QI standards to improve our data. Also, a new partnership with DCA and IT has been forged to accomplish this work. And then finally, resources have been devoted to this upscale, meaning effectively that we now have a more robust data team that can actually do this work and make sure we're able to deliver timely and accurate data. Next slide. Also, and this was mentioned at the beginning, as part of the transparency of our new data work, we'll be having a new joint office website launching in April, and that will include a data dashboard. Now, currently, if you want to look at our data, you have to go through a couple of levels to get to our Tableau dashboards, which do give you quite a bit of data, but this will provide widgets on the front end that will allow you to quickly and easily access data, and will include representation from some of the data task force work that we'll be doing going forward. Next slide. And then there's Built for Zero. So, as many of you know, we've been embarking upon the implementation of Built for Zero for some time now. I think it's important to really think about what Built for Zero is sometimes when talking about where we are in the Built for Zero effort. And I know a lot of people know about the by name list, but they don't understand the dynamic system improvement that Built for Zero represents. So I'd like to talk a little bit about what Built for Zero compels us to do. First of all, there's the quality by name list, which is not a program, but it's a set of standards that it asks us to meet, establishing clear quality improvement and assurance standards, expanding data collection to ensure we're connecting to everyone, and establishing baselines, inflow and outflow, to better understand the landscape of homelessness. And what this means briefly is we're mapping people into the system to understand, are new people in the system coming back to homelessness, or are they new to homelessness, or are they back from an institution? In the same way, we're mapping outflow to see the same data points. It also evolves the way we use case conferencing and our coordinated housing access team. Now, many of you know that we currently have a prioritized list, which is effectively it's coordinated entry, and it uses a variety of vulnerability scores to prioritize people for housing. But Built for Zero asks us to really evolve this and look at everybody in the system and think about the ways that we're prioritizing people and moving people into housing. And then finally, it compels us to make each of these changes with input of key stakeholders and partners. Next slide. So where are we at that? Inside the data infrastructure and governance, we've mapped our data to the Built for Zero metrics, and we have created a retrospective data modeling, which means that we have now looked at the last 6 months of our data, and we'll be unveiling that soon. And this means that we're looking at each data point inside our current system and seeing, are people returning, are they not? And this is a really big part of the Built for Zero effort, because we want to make sure that we really understand our current data, because otherwise we won't know moving forward what sort of impact the work we're doing is having. We'll also be expanding our data collection to outreach and engagement services in the near future. So that's right on the horizon. Inside data utilization, we've expanded our improvement group to include participants who focus on outreach data and chat enhancement, meaning that we've brought more people in who really work on coordinated entry who work in the field on outreach engagement, because we want to make sure that the data collection practices that I just alluded to will be really informed by people who are doing the work and who are speaking to people every day. We're also coordinating with the new vulnerability assessment tool. So one really interesting thing about all this work is we're making improvements while we're changing all sorts of things and expanding programs. One thing that we've been working on for a while is a new vulnerability assessment tool inside our coordinated entry program to replace the VI SPDAT. We wanted to make sure that the data collection that we're going to be doing during outreach and engagement is aligned with this work, and that everything is part of one system rather than creating systems that lay on top of each other and create greater confusion. So we've been working with coordinated entry and the vulnerability assessment tool development to make sure it's the same tool or at least works together. And then finally, with partner input, we've established the improvement group, and we are establishing ongoing work groups to develop the Built for Zero tools. So what this means briefly is when working with our community solution partners, one thing we've talked about is wanting to not just establish brief interventions or one-offs that will inform our work, but really ongoing groups that can truly inform our work. And it so happens at the same time that the Outreach Engagement Work Group was in progress of launching, and it seems like the greatest place to actually go through and move through all our different enhancements and programs. So now that the Outreach and Engagement Work Group is up and in progress, we'll be moving many of the planned assessments through that group to get feedback and to have them suggest improvements. We also are in the process of launching our equity and lived experience committees, which are critical for providing feedback on how this work is affecting people who are actually experiencing homelessness. And this particular piece is very important to us. When we've spoken to other communities that have implemented Built for Zero, some of the key feedback that we've gotten is that if you don't have an ongoing feedback loop from people with lived experience, you're apt to alienate rather than create those sort of linkages that you need to. So making sure that was in place so we can continue to make sure that people with lived experience are part of our PDSAs is really going to be a big part of it. Next slide. So this is the next several months. It is a plan moving forward. You can see we're in November and January right now. Through January right now, we are launching the various groups that I just described. February through April, once we have finalized the point in time count, which is finishing up tonight, so we didn't want to do that right on top of that. We will be utilizing the outreach and engagement group to talk a little bit more about what does outreach coordination look like, what we need to know to match people with services, and this is a big part of you want to know what you're going to do with the data when you're designing the data points. So a big part of that conversation will be asking people in the outreach and engagement group, what do they want to know to match people with services more effectively? And that will inform what data points we'll be collecting during outreach and engagement. We'll also be using this group to navigate barriers to data collection, resistance to data collection, discomfort, making sure that there's not just a form to collect the data, but really a process around it to make sure that people are comfortable with the work. Following that, we'll be doing the rollout and refinement. And Built for Zero is very big on quality improvement PDSAs. So for people who don't know what that means, that's Plan, Do, Study, Act. And effectively what that means is you make lots of small improvements and then you study how they affect people and then you improve. So the spring will basically involve us rolling out the tool in a small area and really looking at how it's working and making sure that the tool works and that the process works before we roll it out more broadly. And we'll have partners and standing groups provide feedback on what is working and what is not. And then finally, in the summer, we're planning to bring in groups that are not normally collecting data to look at how that process that we're rolling out will begin to look, and groups that don't normally collect data, as in groups that are not contracted or consulted, and they'll be consulting to expand our scope to make sure that everything is as transparent and as intuitive as possible. Next slide.
Okay, this is back over to me. So really what we've done up to this point is provide an overview of the way that we really think about health at the Joint Office of Homeless Services and the programs that engage with that intersection, and then finally some of the data improvement pieces that we're improving on. So as we are considering homelessness data, there is some important points to make. That privacy considerations create barriers oftentimes. That homeless providers are often not healthcare or safety experts and are not well positioned to collect health information. There's parallel systems that we engage with the Joint Office of Homeless Services that are crucial to supporting folks experiencing homelessness, including health and safety. That larger studies, there's many studies that have been done on homelessness, and these larger studies have already shown the meaningful impact of housing on health. This intersection is chronicled across the literature. And then finally, as stewards of public dollar, investments in tracking outcomes should be always done with this eye toward program improvement. That's really the thrust of all of our work when it comes to data quality improvement, is having it be interconnected with programmatic improvement that better serves the communities that are most vulnerable in our community, especially folks experiencing homelessness. Can we go to the next slide, please? So We have a number in regards to future opportunities. There's collaborative evaluations and work groups that could shed light on the specific innovations and innovative programming that needs to be expanded. So we're going to be using Fuse as a scalable example to connect with other similar populations on those specific interventions across different systems. We're going to be expanding on scope to explore data analysis for specific programs. We'll be developing evaluation partnerships with healthcare and justice that pose specific questions that can help us understand programmatic impact more holistically and articulate the return on investment, really. If we do it together, for folks that are experiencing homelessness across systems, certainly that coordination can help improve not just outcomes for those individuals, but outcomes for the system as a whole. And then finally, as the chair uplifted and introduced and is really sponsoring, we're going to have a systems data task force to explore and develop recommendations to expand on key performance indicators to make it more clear the impact and the power and the change that our programs are having on folks experiencing homelessness. So these are our future opportunities. Can we go to the next slide? So is there any questions around anything that we have presented today?
Thank you all very much, and I'm sure the answer to that is yes. So why don't we go ahead and start with you, Commissioner Myron.
Thank you so much. Thanks to all of you for the presentation today and for your work over years, some of you, and more recently for others in addressing some of the major needs that we have for data. And as you mentioned, Joshua, and I think others, one of the most important elements of data is to understand sort of a baseline and then understand if our interventions, if our programs are actually working and doing what we want them to do, and to be able to assess, set goals, and measure and tell if we are doing things right or if we need to adjust. And it's, data, far from being the enemy, and it sometimes feels like I hear people talking about data like the enemy, like it's the D word or something. That data it's neither our friend nor our enemy. It just is. It is objective information that can tell us how we're doing. And so in order for it to give us a correct, that correct information about what we're doing, we need to get the right data, and we need it from the right sources, and we need to evaluate it in the right way. And so I am really glad that there will be that there are going to be some future efforts to adjust. Mm-hmm. The one other thing I want to say is that, again, data and what we're talking about with improving systems globally has nothing to do with, but it's not talking about individual people or service providers who do exceptional work every single day. It's not about the organizations that give their heart and soul to their mission, that are doing their best within the structures and systems we set up. It's about systems, and if they're functioning to get populations the best outcomes possible. And the thing, this has been a big deal to me personally, because I've always been involved in systems improvement efforts and continuous improvement efforts. As a physician, obviously we are confronted with a lot of data, a lot of time. I've worked at hospital systems levels and at the state level to look at how we're providing services to people. And there have been some great efforts to improve some of those systems and make connections that could be well employed at the county. I don't think, one of the things I feel that is missing in some of the conversations that we have and in all of the data we collect is sort of the big picture. And how effective is our approach to serving people who are living outside? How, for any population, how effective is that? And I'm not sure that we get to that information through any of the mechanisms that we talked about here today. And it's not, again, not the individuals, it's not your group. This is just what it is. Like, I didn't hear anything that says, here's what we're doing to improve the big picture. And so we need real data about real outcomes. Continuous systems improvement is so important. And what that starts with, I think we're kind of, a lot of the time, maybe we've put the cart before the horse. And we need to start with mapping. Like, do we have them? If we do, share it with me and that'll be great. But do we have a mapping of our data systems, how they intersect, what information they collect, how they talk to each other, whether it's within our own organization, the county, and within our own departments, between departments, then with our partner organizations, and with other organizations like the CCOs, the Oregon Health, or whatever these other criminal justice organizations. But we need a mapping we can look at and get a picture. It's foundational, and it includes those interfaces. Then we can identify a future state we want to get to, and then you say, okay, what are the data points to get us to the future state? So, for example, I'm concerned, like we talk about individual programs a lot, and then we put some, these programs are great and they're intended to do great things, but the outcomes don't show us what they do. So, for example, the number of outreaches or contacts with people doesn't tell us whether people are helped or how many of those are moved through a system, or how many of the broader number of people are even being outreached to. It's kind of just an abstract number without context. And I think that, number of connections, I'll use 211 as an example. Often I see the outcome of number of calls, number of outreach, number of whatever it is. But when you talk to actual people about being served by 211, they're like, yeah, they just gave me a list of shelters I needed to call myself, and everyone was busy and there was no shelters. So that's not success necessarily in my book. So how are we making outcomes be real? And that's important, especially as we're entering into the upcoming budget season and looking at how we're using our resources to make things as effective as possible. With the SHS funds in particular, I do get concerned they're sort of subsumed into the Joint Office of Homeless Services general funds. That they're used just now for sort of all of the purposes of the joint office, and we have so much we need to do. But SHS funding is very discrete. We get it from a discrete revenue source, and then it has a discrete purpose. How are we tracking that? I know Metro is doing sort of the broader tracking. How are we looking at that, and what are our outcomes we're looking at as the county specifically? And so these are the big picture questions, and I feel that, and again, this is not an issue of who did what, who's not collecting this data, who's collecting that data. It's really collaboratively and in a very positive way, getting together to identify what we need to be doing. So we, as the board, can gauge whether we are getting the results of the taxpayer money we're investing in. And so I look forward to having some of the broader conversations. I'm so excited about the data task force and about some of the really proactive work that the new chair is going to undertake. And I know that she is dedicated to this. And so I think our work is cut out for us. And I really appreciate the time you've taken to put this all together and bring it to us. And I know it's like a tip of the iceberg and all of that, but thank you.
Thank you. Commissioner Jayapal.
Thank you, Chair. Thank you so much, Josh and team. And Josh, I'm amazed that you're even sitting here, expecting baby tomorrow. Expecting.
Compartmentalizing.
Yeah. Really, really appreciate the presentation, and I know a lot of work has gone into it. At the risk of being redundant, I'm just going to add my kind of affirmation of how critical I think it is that we improve our data systems. It is absolutely critical to this work, and it's critical, obviously, for transparency purposes. People need to understand what we are doing, how we are doing, what their tax dollars are being spent on. It's critical so that we can evaluate, as Commissioner Myron said, how effective what we're doing is. But even more than that, I mean, that's like a baseline. We then have to use it to figure out what we need to improve in terms of the work that we're doing. And I think I'm excited to see this new sort of attention and urgency. Chair, I appreciate the task force, so I think all of this is going in the right direction. We were in Seattle last week, several of the folks in this room, and we saw what they are doing at King County to monitor just one piece of their homeless service system. We didn't look at all of it, but they have the ability to daily track by name the people who are being outreached on the street and then the progress that's being made into housing. And the reason isn't just to say, look, we're doing a good job moving people into housing. It's to say, okay, this person, and it's anonymized data, but this person has been waiting for 14 days. What is the holdup with this person? And let's clear that barrier. And they have the ability to do that on a daily basis. Now, again, they're not doing that for the whole system, but they're doing it for a sizable chunk of the people experiencing unsheltered homelessness. And that's what we need to be able to get to, in my opinion. I want to say, Commissioner Myron, with respect to mapping, and this relates to something else I just wanted to highlight, the Tri-County Planning Body has identified system mapping, data system mapping, as one of the things that it wants to do. So, I just want to be sure that whatever it is that we are doing, we are coordinating with that regional work, whether it is on the mapping, which is the base point, sort of the starting point, or the redesign of the assessment tool. Now we're using the VI SPDAT. I've heard for a while that we're redoing that. That's something else that the Tri-County Planning Body has identified as a regional priority. So again, I'm assuming we're working with the other counties in partnership on that tool to do that. So I do have I have a lot of questions, but I'll kind of try to stay high level for today. One is about the data on prevention. So we have a prevention stat, which is the number of people that we prevented from losing their housing. Is that simply the number of people to whom we give rent assistance? Because that doesn't necessarily track to preventing homelessness, and I'm wondering whether we have a way to figure out how effective that is.
Let me jump there.
Orla.
Okay, absolutely. So, and how I mentioned earlier that it's hard to create one data point that clearly states whether we are keeping people housed or whether we're preventing housing. This is exactly what this alludes to. Mostly this does track people that are getting assistance, and then we often have program reports of how that's being utilized. But the companion data points to that kind of metric would be the inflow question. So how many people became housed or were not housed? How many people stay housed? But it is a complicated metric, especially when you're looking, as you said, at 50,000 people who received that kind of funding. And so it's a combination of those two, but I think that's one thing that we're trying to move into with partners across the cities and states to talk about what is more effective and what at really measuring that piece. So the direct answer is yes, we're mostly looking at who receives rental assistance to prevent and program follow-up on how that was utilized, but that we do really need better metrics and companion to see how many people are flowing into our system who maybe were prevented briefly but not permanently.
Okay, so that's the prevention piece of it, and we used to be farther along on tracking people that we had placed into housing. In other words, we had a metric that was, I think it was 24-month retention, or maybe it was 18-month retention.
We still do.
I think I heard you say that we are redoing that, and I'm wondering, what was wrong with that metric and what are we adding to it?
So we do still have that metric. We just realized that, so we track that metric. We also track returns to homelessness. And then within that metric, the one you were alluding to just now, we actually have two separate ways of looking at that metric, and that's where the complication lies. In order to track that metric, you need to be in contact with everybody who is housed and continue to follow up with them. And so it's establishing the baseline of, are we looking at every person who was tracked or every person who was followed up with, and probably clustering around those metrics to make sure we're not measuring just the ability to follow up with people, but really measuring how many people stay housed. So really we're looking at, is that metric enough?
Yeah, I mean, I remember that there was a big gap between the people that we were able to follow. So the metric we were using was just the people we had been able to follow up with, which left a lot of people.
Exactly.
Okay. A little bit about the assessment tool that we're developing. You've referred to it as a vulnerability assessment tool, which is what I understand the VI SPDAT was. What I'm learning based on lots of conversations is what we really need is a tool that matches what people need, matches them to what they need, and we need a tool that tells us what they need. So is that what we're moving to, or is it just a refined vulnerability assessment?
I'm going to speak to this briefly and turn it over to Anna because this is happening within her department, but I think the answer is both, right? Vulnerability can be measured in a variety of ways, and once you know that somebody has a certain level of vulnerability, which I realize in and of itself is a weird way to measure, but you need some way to prioritize people, you do get into that subsectioning of different kinds of lists and different kinds of needs. And with that, I will turn it over because I know you've been involved in that work more.
Yeah, and I would echo a lot of the same things that Lori just noted, that there are some flaws that are inherent within the VI SPDAT that we are working to make adjustments to. And it's not the tool that gives us the most clear picture of what a person's housing needs look like. So it's an iterative process. We're working towards that in partnership with Clackamas and Washington counties.
Okay, and great. That's good to hear. We're working with the other, because this was I think I said this already. I can't remember, but this is the other another priority that the Tri-County Planning Body has identified, is that we just really, really need not just a better vulnerability assessment, but a different tool altogether in order to make sure that we're getting people to where they need to be. I think I have a lot of other questions, but they are even further into the weeds, so I'll find another way to follow up. Thank you.
Thank you. Commissioner Rosenbaum.
Thank you, Madam Chair, and thank you for an excellent presentation. There's a lot packed into this. And just to echo my colleagues' comments, this is obviously a critical tool. And, what good does it do to do a great job if we can't track exactly what we're doing with all these metrics? I just had a couple of questions. I'll just ask them both and whoever can respond. But clearly there's a role for our community partners, particularly the service providers, and I'm curious how they're reacting to this. Are they supportive? Do they see it as just one more burden on them? And then you touched on this, but for the public, obviously you mentioned a website that they can access. How will they know what's out there and how this information might be available to them so that they can access it if they need it?
I think the best way to describe this is one of the reasons we wanted to make sure the outreach and engagement group was not just formed, but actually getting comfortable with doing, like knowing each other and working with each other, is so we could really know how our providers are responding to this. Because my experience has been that when you ask people to do something new without their feedback, you can get a variety of responses, and sometimes you can just not even have them do the work, depending on how comfortable the work is. And so part of the point is that you have a group that regularly and frequently is involved in this kind of work and provide feedback around what we're asking for, so that we actually know that it's being informed by not just best practice, but really what is appropriate and what's comfortable. And with that.
Yeah, I would add to that we want this tool to be useful to the people who are using it. Outreach workers who are connecting people to housing resources, this needs to be a data set, a data tool that is useful to them in achieving that, as well as giving us the information that we need. We don't want to collect data just to collect it and have it. We really want that to be functionally useful for the people who need it. So, as Lori mentioned, we have the Outreach and Engagement Work Group that is really getting into deep conversations about what does it mean to have coordinated street outreach and what does it mean to have a real-time data-driven feedback loop that helps us design an outreach system that meets people and meets the entire need.
Okay. And then the other part of your question I heard is how folks can access this information. As Lori uplifted, we're going to be launching a website that has up-to-date information on the outcomes of our systems. So folks will be able to access information through that website. I think also additionally, as we've talked throughout this presentation, we have a number of different work groups that folks can participate on where we'll be not just sharing information, but also receiving feedback. There's going to be a feedback loop in regards to the adoption and ongoing implementation of some of these tools and processes that we uplifted throughout this. So I think it's really those two things. And then of course, we also do have a newsletter where we're also going to be providing up-to-date information on all these quality improvement efforts that we've been talking about. So I would say that those are three primary ways, but also we're also more than happy to have a conversation with anyone who has questions about this.
Thank you.
Thank you.
Hey, thank you. Commissioner Stegman.
Thank you, Chair. Well, first of all, I'm really excited about the Systems Data Task Force. I did have a question. So who will be on that task force?
So I'll take that question. So right now we are looking at having myself and Commissioner Myron, someone from, at least one person from the joint office, someone from the city of Portland, and then probably about 4 or 5 other folks that we're going to identify as the right people to be able to provide the perspective and the expertise that we need in terms of talking about these things. And the goal is to build on what is already planned with the joint office, with this the updated website that is going to be rolling out, with the work that is happening with Built for Zero, with the work that's happening with Fuse, and a lot of these other things. I think, as Commissioner Jayapal mentioned, there's a lot of work happening at the regional table, so I think that needs to obviously inform the work that's going to be happening with the task force, as well as making sure, I think, the timing of the work that's happening at the regional level will match with the work of the task force as well. The task force itself is only envisioned to be about like a 45-day thing. So it's really, its key focus is to look at what are the additional key performance indicators that we want to have in place and be able to track when the refresh of the site goes live later this spring. And that's that. I think through our conversations, we are probably going to identify need for continuous work in incorporating data, the data metrics and things that we want to be incorporating, like if there's system mapping that's going to be happening, how are we going to be bringing this in? One of the things I really appreciated that you mentioned is the continuous improvement piece, right? Because that is something like the task force has a very specific goal, but it is going to be a part of this ongoing work that we're doing to make sure that we have the right systems in place, the right communication happening, the right supports for the providers that are out there doing this frontline work to be getting this information, getting the right information, and then using that information to see how we're doing and communicating that transparently to the public.
And thank you, Chair. I appreciate that. So I'm sorry, did you say that this is going to be a temporary or an ongoing committee?
Temporary. It's a task force that's going to have a specific task of looking at additional key performance indicators that we want to include on the updated website that's going to be launching this spring.
Very good. Thank you so much. I had some specific questions. Often we hear stories or narratives that our shelters are not being utilized. And I've heard, is it like 80%? Do we know what capacity our shelters are on average? And I'm sure that data is being tracked. So maybe if you could talk about where that data is or where it will be. And is that 80%? Is that in the ballpark? I don't know.
I don't have that stat right on the top of my head, but one of the links that was supplied in the presentation can bring you to where all of our reports are located. And one of the ones that we do update regularly is the shelter utilization report.
Okay, very good. Yes. I'll take a look at that. And then around the employment, I'm curious, the transfer piece and CCC, So I'm trying to figure out, what lack of capacity. So what is the overall problem? I mean, are there more people that would like to have jobs, or do you think that we're maxed out at the number of job positions that we're offering? And you can get back to me if you don't know this off the top of your head.
Low barrier employment program, if you want.
I think that there's people who want jobs, and one of the gaps that we're aiming to fill with this particular kind of set of employment services is really low barrier employment services. So not everyone is going to be ready to hop into a regular Monday through Friday 9 to 5. So these opportunities create opportunities for folks to have access to income, to have something to build upon. That's very, very low barrier.
And if I could add it, and in addition, with the low barrier employment, then it's kind of there's opportunity then to be a lead there, and then grow within or not. Excuse me. And then the other thing, later today or tomorrow, we'll have the newest shelter utilization report up on the website. So it'll give you some accurate data of the last month of shelter utilization. Yeah.
Great. Thank you, Kanoy. So that's great that we're offering low barrier employment. But my question is that just wide open, that we have more jobs than people? Or is it, or do we need to open that up more?
Well, thank you for the question. I mean, I would say it's one pathway in which we're engaging folks, right? So it's one pathway in which is an opportunity for folks to be able to then get connected to other resources to build that community. So I would say that I think we can always, we are with the Metro Supportive Housing Measure, we've expanded that opportunity, and I think we can continue to expand that, knowing that the types of employment services too are beneficial then to the community, right? So we're having, whether it's trash pickup, whether it's connecting out to the shower and hygiene services. So I think, to your point, being able to increase that opportunity, yes, I think it could be needed, and it then serves additional purposes throughout the system as well as for the individual. Did anyone else want to add anything to those pieces to answer?
And Commissioner Stegeman, I kind of hear you asking too whether we're at capacity, right? Whether we're at capacity with this employment program, which we can certainly get back to you on terms of how the outcomes of that specific program. So is that right?
Yeah, I mean, we're talking about data, and really it's like, are we, certainly we need to right size everything. And so that's my specific question around employment is that, can you track that and right size it for low barrier employment and then other, up the scale? So is that something that you're tracking as well in the data?
Do you want to take that?
Yeah, and I think we can get back to you on that specific question, especially with the way in which the SHS has enhanced our employment opportunities, because we do have previous employment opportunities that aren't just low barrier, right, with some of our other providers. So to your point, how we're tracking to the current investment in the breadth of what we're doing. Yes,
okay,
thank
great.
you.
Thank you, Kanoy. Okay, that's good. So the other thing is that whether or not this narrative is true or not, I don't know. But I've heard media outlets say that, a large percentage of people that receive outreach were never offered housing. And so I'm trying to figure out, and hopefully that's where all this data is going to tell us, where are the bottlenecks? So, and what is our approach is that, okay, if we know that, and clearly we know there's not enough housing, but I'm just trying to figure out the overall strategy that if you can't offer somebody housing, then what is the strategy? And so, I mean, I know this is a larger, and I don't know that there's one pat answer, but I'm like, okay, well, I'm just trying to figure out where are the bottlenecks, and if we can't offer somebody housing, then what are we offering them? Or do we just, I don't know. I'm sure I think we're all feeling a little bit frustrated, but I'm just trying to have grasp onto something that, so I guess the first question is that, are we not offering people housing? And if we're not able to do that, then what are we offering them?
I think it's compilation.
Yeah, I think
Should
it's
we all do it. Do you want to go first and then I can?
Okay. How about you hop in and
Okay. I actually wanted to mention something that Commissioner Jayapal noted around that. To be able to get that real-time data about what we're doing too out there is extremely important to then be able to assess where are those gaps. So that larger kind of conversation. And then it's, our outreach workers, we have outreach workers and our service navigation folks. And so the navigation teams are providing out resources as far as your mention about housing. If it's not housing, well, what is it? And so it's a range too of shelter options that can be provided in addition to then you have your permanent housing. And so you have to ramp up to that too, right? So if we don't have the available permanent housing in the moment, what are those other shelter types or resources that that person might want to engage in? And at that point, maybe that isn't what they want to engage in. Maybe it is a warm cup of coffee, and a person to engage with initially. So I think we have to be able to address that type of narrative in that the first time you're meeting with somebody, the second or third or fourth time, it's not always that it's the housing that they want to engage with in that conversation. It can be a plethora of different things. But I do think as we're building out the way in which we're tracking need and what is going on for an individual, I do think something, sorry to keep going back to what Commissioner Jayapal had mentioned, but if it is the 14 days, what is happening? Or what is, being able to assess and working with our outreach teams, being able to build that data, the by name list, I think will further help us isolate specifically too for folks, what is that, and to build that narrative. Anything additional from the groups?
I'll add some stuff because I hear you asking about the systems that are in play that are tracking this. I think what actually Commissioner Jayapal uplifted around the Seattle model is sort of kind of gives almost a template on where we could go. But the thing that is really important about what was uplifted in Seattle was that it was a discrete geographic area, and that data is only as complete as the folks that are inputting it. So in Seattle, in that discrete geographic area, there was folks that were engaging every single day with people that they actually knew. So it was a combination of what Conoy was uplifting around the relationships. It began with that relationships, and then there was question asked around, where is it that you want to go? Do you want housing? Do you want something else? So that model is important, and while something like that could potentially be replicated here, it was a sort of a smaller scale type of thing. So when we're talking about systems improvements, what we're looking at right now is trying to figure out how we can get the most up-to-date outreach data and navigation data, while also understanding that there are going to be potential bottlenecks like what you uplifted, Commissioner Stegman, especially because we actually have to have folks to scale to be able to engage in an area with individuals that they know. And Multnomah County is a lot larger than a particular area in our region. So I think that that's an important piece. And I don't know if there's anything else that you would want to add, Lori, because I know we've talked about this a lot.
I think that's true. So I think often people miss that you can track very vibrantly and actively within a small set of people. And we mentioned that a little bit with groups like Fuse, where you can pick a group and track that really emphatically and then make sure you know that. But when you begin to think about it from a system level, it requires a little bit more. The thing I actually wanted to lean into just a little bit too was, I think sometimes behind some of these questions of what does the data tell you? How do you seek understanding behind the numbers that we get with so many numbers that we're pulling in? And one thing we often don't talk about is we have a small but mighty evaluation team that's seeking to employ both qualitative and qualitative evaluations behind the data. So when we see a set of data and we're like, that's interesting, right? What does that mean that 50,000 people were served? Or what does that mean that people are exiting to homelessness? Why is that happening? That discrete evaluation projects are being built up right now, often with partners like the Health Research Action Collaborative, to really look at the data and ask sort of more pointed questions in small areas to try to get at exactly what you're asking for, which is, what are the blockers? What are we missing? What do we need to know to do this work better? So I do feel like that's an important partner to the data that we collect, which is not just the numbers, but really looking at the numbers and beginning to dive behind them and think about, what would I ask to understand this number a little bit more effectively? So that's a part of it too, and we can share that evaluation. We have a whole framework that we've developed that's intended to be iterative and also responsive to the evolving situation that's going on.
And then the final thing, sorry, this is a complex answer. So the final thing is that when Conoy uplifted that cup of coffee, or I'm uplifting relationships, we always are person-centered in all of our systems, right? So when we're talking about outreach and navigation, it really does always begin with that relationship between the outreach worker or the navigation worker and asking folks what it is they need. But it's not just the relationship. The relationship is an inroads to ultimately providing for the needs of that particular person, so that way they are on their journey to being housed. And that's the focus of all of our systems. So when there is this question on whether housing was explicitly offered in one meeting, we can't necessarily answer that. But the purpose of all of that, though, is ultimately to support folks to be on their journey to being housed.
Thank you. And I realize that, it's maybe a question that can't be answered. But I guess my point is that in my very, very limited experience of doing, some small amount of outreach, is people that I encountered said, "Can you help me with housing?" We're making, and it is really complicated, I get that. But at the end of the day, it's about getting people housed. Mm-hmm. Yes, they need all of those things that you're talking about. And I'm excited that Governor Kotek has this initiative to build more housing. But and all of this is important, but in its most simplistic way, we need to get people housed. And whatever, what are those tools and all of those things that you are talking about, we need to do. So anyway, I won't belabor that. But okay, so the other questions I had was, let's see. So you probably are all very familiar with Bybee Lakes, and I think we've all toured. And one of the things that I was really impressed with them is their usage of the data. They have like the ID cards or bracelets. It's like a VARS code kind of. So their residents, like if they get something to eat or if they go to a class or a training, they can track the success or lack thereof or participation of each of their enrollees. So I'm just wondering, with Built for Zero, and you can come back to me, what is the plan? Is there some type of, I know there's HIPAA, but there could be some way to give houseless individuals some type of identification that help track where they're at in their journey and where they need to go next. So is that something you all are working on?
There are certain programs that we fund now that even have like ID cards that people can use to access information and barcodes. I don't know that we've ever looked at barcoding. Adding. There's enough information that we collect through the by name list that we can de-identify and track people through our system as it is without really needing to do that. It's definitely an idea. And I know that certain groups and certain day centers have that work already, so they can get a sense of what's being utilized, often with an eye towards what's needed rather than tracking each person's discrete utilization of that particular particular service. And I think that's where that eye is. There's also many creative ways that people have found to just track where people are doing or what they're utilizing through sort of like understanding what's being utilized. So I think for me, it's really is the goal to understand what services are needed, right? Or to understand what tracks are most successful to getting people to housing, in which case some of our evaluative framework mixed with the by name list, which should get us there.
Yeah, and that's great. And I think, it's kind of like, we have a doctor. So when you see a patient, you pull up their chart and that person doesn't have to tell you their entire health history and be re-traumatized every time to tell their story. So if there are a way to say, this is Lori, she's been homeless for X amount of time, she has, these challenges, she's really hoping to do X. So that's why so that's kind of where I'm going, and hopefully this data can be the foundation of that. And then I'm wondering too, so Built for Zero, how is that data going to interact with our dashboard? Or are they two separate systems?
They're one and the same. So Built for Zero is a framework that's laid over our current system. They don't have a separate data system they supply us with. They more give us a set of standards that were intended to utilize in order to get better data. So we have one system, and exactly for what you just described,
Great.
that there's not multiple data systems. I mean, different organizations may have their own unique data systems to do their work, but in general, the overall system is one system that would feed into the Built for Zero mapping, that would feed into any dashboards that you're going to be seeing. And the intent is to increase the quality and comprehensiveness of that central system rather than building parallel systems that also would require multiple data entries, which is a pretty big barrier in a lot of groups that are already taxed as it is.
No, that's great, fantastic. And so I'm also wondering, I think somebody else had mentioned it, is that clearly our CBOs and nonprofits, we're going to have to engage with them because it's going to probably create more work for them. And how are we addressing that? Are we incentivizing, it's like, hey, we're going to start this new program. It's really important, but it's also going to take you 20% more of your time to enter the data. And so how are we managing, incentivizing, and encouraging our CBOs and nonprofits to embrace that?
That's a good question. So some of the feedback processes that we're trying to build are exactly to get to what would work. And so one of the reasons we've been going step by step of you start with the groups that are already contracted and required to do this work is to make sure the data process is as simple and easy as possible. And then when we move to that next step, which is you don't ask for this data, we do have some funding that we have budgeted in the past, and we'll look towards asking them what would make that more easy, but also designing a system that's a little easier to use so it's not so heavy. So I think that's why we're simultaneously in the exploratory phase, which is how do we do this as easily as possible, and then what would make it easy for them to do it. So in step by
Great.
step.
Okay, very good.
And then the other thing I would add just to that too
Yeah.
is as we move forward with any changes in our systems, we do provide TA and consultations with agencies as we're adopting any changes. So it's both the front end of creating a easily usable system, but then there's also support for our community-based organizations to adopt any changes that we're making across the system.
Great. Well, I'm glad you're addressing that part of it. And what about, so what is the next step? Will we be receiving another update in a quarter, or how will you keep us apprised of your progress?
So as the slide showed, there's the timeline for getting the information updated on the website. I think there will be some outcomes from the task force. So I think either we'll have a board briefing on it, or we can ask the Joint Office to brief commissioners individually, depending on interest in this. But we can definitely have some follow-up as we're doing this. I think when we have the new dashboard that's ready for release, that's something we're definitely going to want to publicize and make sure that people know the information is there so that people will know how to find it.
Great. Well, thank you so much. I know you all have been kind of grilled, but obviously this is a really urgent topic for all of us. And it's like, I've got you here, so I want to ask you these really hard questions, but also really want to appreciate all of your work. I know that there's been a lot of change, and you all have risen to the occasion, and there's much more change to come, and just really want to appreciate your commitment. Thank you.
Thank you. And I will say, for any of the commission and the chair, if there are additional questions that, I think Commissioner Jayapal said she had some in the weeds questions, and Commissioner Myron had some questions, we're more than happy to, collect those and respond to them.
Mm-hmm. Well, I want to thank all of you as well. Thanks so much for the time today and all the work that you're doing in general, but especially around this question of data, information, and tracking, and making sure that we are being the most impactful, having the biggest impact on people's lives in a really positive way as possible. I mean, that's really at the heart of what we're here to do in the work of the Joint Office, is how do we get people into housing. I also appreciate the questions that we've had from the board today. I will say one of the things that was pretty apparent in the trip to Seattle, they really talk about it as a pilot because it is a very discrete geographic area that they're working with, that they're able to put a lot of resources to. So they're having that daily contact, they're really building relationships, and they have an end goal. They have a timeline and an end goal. And that end goal is getting people into housing. There is no other goal than that is to getting people into housing. And so they have not just the team that's working with the people who are in these areas, but they also have a team that's working on housing acquisition, working to find either that public housing, that affordable housing that is appropriate for permanent supportive housing capabilities. They're working with private landlords to get housing right. So it is a very much a lot of resources going to get this, and seeing if that type of program, that type of work that is happening there so intensely is something that they would be able to scale to a larger, of really having that focus on housing for people. And so it's not, they're really not doing we're going to be moving people aside from a place. We're doing this work, but we're doing it with the end goal of getting folks into housing. And that was something that was really their key thing, which was pretty incredible. I do think that, and the other question that I really, or the thing that was brought up by both you and Commissioner Rosenbaum, was just the impact on the providers. I mean, I think as we're looking at this, right, as we're building this robust system of homelessness services, as we're really trying to find out the impact that we are having, we have to have the good information, and it is going to require doing things differently than they've been done in the past for some of the providers. And so that's why the work that's happening at the regional level of what support do providers need overall, what investments need to be made, what can we do to provide technical assistance, to provide the supports that are needed to do this, and also, making sure that we are listening to the people who are having the experiences, the people with lived experience, of what is the best way to continue to have those interactions so that they are fruitful, so that people feel that they're informed, so that we're getting that information, we're getting that data, and we're having those kind of interactions that we want to have in order to get the results that we want. So there's a lot of work that's happening, but I just really, I appreciate the work that you're doing. I appreciate the work that the providers are doing to help us get in that space. And I think it's pretty exciting, all of the things that are in the process, as well as the work that's happening regionally, to really grow up this system in a way that's addressing the need and the urgency and the scale of the crisis that we're facing. So I appreciate this. More to come and more information to come. I did want to say two things before we adjourn. One, Josh, good luck, and hope everything goes really well tomorrow for you. We'll be thinking about you. I also wanted to take a moment to acknowledge this week the death of one of the most dedicated public servants that we've had at Multnomah County, District Attorney Mike Schrunk. He served as the district attorney for a really incredible amount of time, from 1981 to 2012. And in that time that he was the district attorney, he was really years ahead of his efforts to really be an early proponent of treatment instead of prison time. He started the second drug court in the nation. So, Multnomah County was actually the second in the nation to establish a drug court. He served with 8 Multnomah County sheriffs and 9 Multnomah County chairs, so really saw a lot of changes here. He was before my time. I think he was before everyone's time here, in serving in the county, but I do, appreciate his legacy and really hope to carry on the values of transparency, of justice, and really faith in the people of this community. So I'd ask everybody to just have a moment of silence in honor. All right, thank you very much. And with that, we are adjourned.